Should I get a total hip replacement for osteoporosis hip fracture? When a hip fracture happens due to osteoporosis, it can be a life-changing event. Osteoporosis weakens bones, making fractures more common, especially in the hip. If you experience a severe fracture in the femoral neck or the upper part of the thigh bone, your doctor might consider a total hip replacement. This surgery involves removing the damaged parts of the hip joint and replacing them with an artificial implant. It is often recommended when the fracture is complex, unstable, or unlikely to heal properly with simpler treatments. Total hip replacement is most frequently used for severe osteoarthritis, but it is also a common option for certain types of hip fractures, especially in older adults. If the fracture is in the femoral neck and the blood supply to the bone is compromised, healing can be difficult. In such cases, replacing the joint can restore mobility, reduce pain, and help you regain independence faster. The decision depends on factors like the exact location and severity of the fracture, your overall health, and how much the injury limits your daily activities. Having osteoporosis does increase some risks with hip replacement surgery. Because the bones are weaker, there is a higher chance of fractures during or after the procedure. There is also a risk that the implant might loosen or that fractures could develop around the implant, known as periprosthetic fractures. However, surgeons are trained to minimize these risks by using special implants, bone cement, and careful surgical techniques. They will also evaluate your bone health beforehand to choose the best approach for your situation. After surgery, managing osteoporosis remains crucial. Continuing medications to strengthen bones, ensuring adequate intake of calcium and vitamin D, and engaging in weight-bearing exercises can help protect your bones. Making your home safer by removing fall hazards and using assistive devices can also reduce the risk of future fractures. Your healthcare team will help develop a personalized plan to support your recovery and long-term bone health. In summary, a total hip replacement can be a good option for some people with osteoporosis who suffer a severe hip fracture. It is especially helpful when other treatments are unlikely to succeed. The decision should always be made in consultation with your healthcare provider, who will consider your overall health, fracture type, and personal needs. Managing osteoporosis before and after surgery is essential to improve your chances of a successful recovery and to prevent future fractures. Always seek personalized medical advice to determine the best course of action for your specific situation.